Question 1. A client who is learning to manage their type 2 diabetes asks the nurse, what is the primary function of insulin in the human body? A. To break down fats for energy. B. To lower blood glucose levels. C. To increase the production of red blood cells. D. To strengthen bone density. Answer: B. To lower blood glucose levels. This question tests basic anatomy and physiology, specifically the role of hormones like insulin. The keyword primary function indicates you should identify the main action. Insulin is a hormone produced by the pancreas that helps the body's cells absorb glucose, sugar, from the blood, thereby lowering blood glucose levels. Without enough insulin, or if the body resists its effects, glucose builds up in the blood, leading to diabetes. For example, after eating, insulin is released to move the sugar from your meal into your cells for energy or storage. Remember that insulin acts like a key, unlocking cells to let glucose in. Question 2. A nurse is preparing to administer 500 milligrams of a medication. The medication is available in tablets of 250 milligrams each. How many tablets should the nurse administer? A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Answer: B. 2 tablets. This question assesses fundamental dosage calculation skills, a critical aspect of safe medication administration. To determine the number of tablets, you need to divide the ordered dose by the dose available per tablet. In this case, 500 milligrams, ordered dose, divided by 250 milligrams, available dose per tablet, equals 2 tablets. This simple calculation ensures the client receives the correct amount of medication, preventing underdosing or overdosing. For example, if a doctor orders 100 milligrams of a pain reliever and each pill is 50 milligrams, you would give 2 pills. Always double-check your math to ensure client safety. Question 3. Which of the following is within the typical scope of practice for a licensed practical nurse, LPN/LVN? A. Initiating intravenous, 4, push medications. B. Performing a comprehensive client admission assessment. C. Administering oral medications and basic wound care. D. Developing a client's plan of care independently. Answer: C. Administering oral medications and basic wound care. This question evaluates your understanding of the LPN/LVN scope of practice, which defines the tasks and responsibilities a nurse can legally perform. The keyword typical scope directs you to general LPN duties, as specific scopes can vary slightly by state. Administering oral medications and performing basic wound care are foundational skills that LPNs are educated and legally permitted to perform under the supervision of a registered nurse or physician. For example, an LPN can give a client their prescribed blood pressure pill and change a simple dressing on a surgical incision. Always remember that LPNs focus on stable client care and direct implementation of the care plan, not independent assessment or complex interventions like 4 pushes. Question 4. Before providing direct client care, a nurse must perform hand hygiene. What is the most effective method for routine hand hygiene in a healthcare setting when hands are not visibly soiled? A. Wearing sterile gloves. B. Rinsing hands with water only. C. Using an alcohol-based hand rub. D. Washing hands with plain soap and water for 5 seconds. Answer: C. Using an alcohol-based hand rub. This question assesses knowledge of basic infection control principles, specifically hand hygiene. The critical phrase, "not visibly soiled," indicates that vigorous washing with soap and water is not always required. An alcohol-based hand rub is highly effective at killing most common pathogens that can cause infections and is the preferred method for routine hand hygiene when hands are not visibly dirty. For instance, after taking a client's vital signs but before giving medication, using an alcohol rub is appropriate. Always remember that proper hand hygiene is the single most important action to prevent the spread of infection in healthcare settings. Question 5. A client's medical chart indicates they have dyspnea. What does this medical term refer to? A. Difficulty swallowing. B. Shortness of breath. C. Painful urination. D. Nausea and vomiting. Answer B. Shortness of breath. This question tests your understanding of common medical terminology, which is essential for accurate communication in healthcare. The term dyspnea is derived from Greek words meaning bad, difficult, painful, dys, and breathing, ni. Therefore, dyspnea directly refers to shortness of breath or difficulty breathing. Understanding these terms helps nurses accurately interpret client symptoms and communicate them effectively to other healthcare providers. For example, a client with asthma might complain of dyspnea during an exacerbation. Familiarize yourself with common prefixes, suffixes, and root words to decode medical terms efficiently. Question 6. When documenting client care, what is the most important characteristic of the information recorded? A. It should be written in conversational language. B. It should only include positive client responses. C. It must be accurate, factual, and objective. D. It should be written quickly to save time. Answer C. It must be accurate, factual, and objective. This question focuses on the principles of professional documentation, a cornerstone of safe and effective nursing care. The keyword most important characteristic directs you to the foundational quality of all nursing notes. Documentation must be accurate, correct, factual, based on observations, not assumptions, and objective, without personal opinions or interpretations. For instance, instead of writing "client seems sad," you would document "client observed crying quietly in bed, states I feel hopeless." Precise and objective documentation ensures continuity of care, protects the client and nurse legally, and supports effective communication among the healthcare team. Question 7. Which of the following foods is the best source of protein for a client following a vegetarian diet? A. White bread. B. Apples. C. Lentils. D. Butter. Answer C. Lentils. This question assesses basic nutritional knowledge, specifically identifying protein sources for specific dietary needs. Lentils are legumes that are an excellent source of plant-based protein, fiber, and various vitamins and minerals, making them a valuable food for individuals following a vegetarian diet. White bread and apples provide carbohydrates, while butter is primarily fat. For example, a vegetarian client could eat a lentil soup or a lentil burger to meet their protein requirements. Understanding different food groups and their primary nutrients is crucial for educating clients on healthy eating. Question 8. A nurse is preparing to change a sterile dressing on a client's surgical wound. Which personal protective equipment, PPE, is essential for this procedure? A. Gown and goggles. B. Non-sterile gloves. C. Sterile gloves. D. N95 respirator mask. Answer C. Sterile gloves. This question tests your knowledge of appropriate personal protective equipment, PPE, for different procedures, emphasizing infection control. The phrase sterile dressing on a client's surgical wound is the key, indicating the need to maintain a sterile field to prevent infection. Sterile gloves are crucial for procedures that require contact with non-intact skin or sterile body sites, like surgical wounds. Using sterile gloves minimizes the risk of introducing microorganisms from the nurse's hands to the vulnerable wound site. Always choose the correct PPE to protect both yourself and the client from potential infection. Question 9. A client states, "I'm so worried about going home, I don't know how I'll manage my medications." Which response demonstrates therapeutic communication? A. Don't worry, you'll be fine. B. You should ask your doctor about that. C. It sounds like you're feeling anxious about managing your medications at home. D. Many people feel that way. Just follow the instructions. Answer: C. It sounds like you're feeling anxious about managing your medications at home. This question evaluates your understanding of therapeutic communication, a vital nursing skill. The correct response uses reflection, a technique where the nurse restates the client's feelings to show empathy and encourage further expression. Phrases like, "It sounds like you're feeling," validate the client's emotions and open the door for them to elaborate on their concerns, which is essential for effective problem-solving and support. Simply dismissing their worries or redirecting them avoids addressing their underlying anxiety. Always aim to listen actively and reflect the client's feelings to build trust and facilitate open communication. Question 10. A client reports severe pain in their lower right abdomen. What is the immediate priority action for the nurse? A. Administer a pain medication immediately. B. Document the complaint in the client's chart. C. Assess the client's pain level and vital signs. D. Call the client's family to inform them. Answer: C. Assess the client's pain level and vital signs. This question assesses basic clinical judgment and prioritization in nursing care. The keywords immediate priority action require you to identify what a nurse should do first. Before administering any intervention or contacting others, the nurse must gather more data to understand the severity and nature of the pain. Assessing the client's pain level, e.g., using a pain scale, and vital signs provides crucial information that guides subsequent actions, such as notifying the healthcare provider or administering appropriate pain relief. Always remember that assessment is the critical first step in the nursing process to ensure safe and effective care. Question 11. A doctor orders 0.5 grams of a medication. The medication is supplied in 250 milligrams capsules. How many capsules should the nurse administer? A. 1 capsule. B. 2 capsules. C. 3 capsules. D. 4 capsules. Answer: B. 2 capsules. This question tests your ability to perform unit conversions and dosage calculations, a common task in medication administration. The key is to convert grams to milligrams, as the medication is supplied in milligrams. Knowing that 1 gram equals 1,000 milligrams, 0.5 grams is equivalent to 500 milligrams. Then, divide the ordered dose, 500 milligrams, by the available dose per capsule, 250 milligrams, which equals 2 capsules. Always perform necessary conversions before calculating the dose to ensure accuracy and client safety. Question 12. Which body system is primarily responsible for the transport of oxygen, nutrients, and waste products throughout the body? A. Digestive system. B. Nervous system. C. Circulatory system. D. Respiratory system. Answer: C. Circulatory system. This question evaluates your understanding of basic anatomy and physiology, specifically the functions of major body systems. The transport of oxygen, nutrients, and waste products is the primary role of the circulatory system, which includes the heart, blood vessels, and blood. The heart pumps blood through the vessels, delivering oxygen and nutrients to cells and carrying away waste. For example, oxygen picked up in the lungs is circulated to all body tissues by the circulatory system. Think of the circulatory system as the body's vast highway network, moving essential substances to where they are needed. Question 13. A client refuses a prescribed medication. What is the nurse's most appropriate initial action? A. Document the refusal and discard the medication. B. Explain the potential consequences of refusal and notify the healthcare provider. C. Force the client to take the medication for their own good. D. Ask the client's family to convince them to take the medication. Answer: B. Explain the potential consequences of refusal and notify the healthcare provider. This question tests your understanding of client rights and ethical nursing practice. A client has the right to refuse treatment, even if it is beneficial. The keyword "most appropriate initial action" guides you to the first step. The nurse's role is to ensure the client is fully informed about the potential risks of refusing treatment. After providing this information and confirming the client's understanding, the nurse must then inform the healthcare provider so that alternative plans can be made if necessary. This respects client autonomy while ensuring their safety remains a priority. Question 14. To prevent falls in an elderly client who is confused, which intervention should the nurse prioritize? A. Administer a sedative to calm the client. B. Keep all four side rails of the bed raised. C. Ensure the call light is within reach and encourage its use. D. Leave the client's room door open for easy observation. Answer: C. Ensure the call light is within reach and encourage its use. This question focuses on client safety, particularly fall prevention strategies. The phrase prioritize means choosing the most effective and safest initial action. While other options might seem helpful, ensuring the call light is within reach empowers the client to request assistance, which is a primary fall prevention strategy. Raising all four side rails can be considered a restraint and may lead to injury, while sedatives can increase confusion and risk. Always prioritize interventions that promote client independence and safety without restricting their rights or creating new hazards. Question 15. A nurse notes that a client's rash is located on their anterior trunk. What part of the body does this describe? A. The back of the body, near the spine. B. The front of the body, between the neck and pelvis. C. The lower extremities, such as the legs. D. The upper extremities, such as the arms. Answer: B. The front of the body, between the neck and pelvis. This question tests your knowledge of anatomical terms and directional prefixes, which are crucial for precise communication in healthcare. Anterior refers to the front of the body, and the trunk refers to the main part of the body, excluding the head, neck, and limbs, typically extending from the neck to the pelvis. Therefore, an anterior trunk rash would be found on the front of the chest or abdomen. Understanding these terms helps ensure that all healthcare professionals interpret observations and instructions consistently and accurately. Think of anterior as a forefront and abdomen. Question 16. What is the recommended average daily water intake for an adult to maintain proper hydration? A. 1 to 2 cups. B. 4 to 6 cups. C. 8 to 10 cups. D. 1 to 2 gallons. Answer: C. 8 to 10 cups. This question assesses basic knowledge about nutrition and hydration, an important aspect of health promotion. The general recommendation for most healthy adults is to consume approximately 8 to 10 cups, or about 2 to 2.5 liters, of water daily to maintain proper hydration and bodily functions. This intake can vary based on activity level, climate, and individual health conditions. Staying well hydrated helps regulate body temperature, transport nutrients, and lubricate joints. Remember to encourage clients to drink water regularly throughout the day, even if they don't feel thirsty. Question 17. A nurse is assessing a client's vital signs. Which of the following is considered a normal adult resting heart rate range? A. 30 to 50 beats per minute. B. 60 to 100 beats per minute. C. 110 to 130 beats per minute. D. 140 to 160 beats per minute. Answer: B. 60 to 100 beats per minute. This question tests your foundational knowledge of normal vital sign parameters, which are essential for recognizing deviations and potential health issues. For most healthy adults at rest, a normal heart rate, pulse, falls within the range of 60 to 100 beats per minute. Rates below 60 are called bradycardia, and rates above 100 are called tachycardia. For example, if a client's resting heart rate is 115 bpm, it would indicate tachycardia and warrant further assessment. Knowing these normal ranges helps you identify when a client's condition requires further attention. Question 18. A client has consumed 40% of their 2,000 milliliters daily fluid intake goal. How many milliliters has the client consumed? A. 40 milliliters. B. 400 milliliters. C. 800 milliliters. D. 1,200 milliliters. Answer: C. 800 milliliters. This question assesses your ability to calculate percentages, a common mathematical skill used in nursing for intake/output, medication dosages, and other measurements. To find out how many milliliters the client consumed, you need to calculate 40% of 2,000 milliliters. This is done by multiplying 0.40, 40% as a decimal, by 2,000 ml, which equals 800 milliliters. For example, if you need to give 20% of a 50 milliliter solution, you would calculate 0.20 by 50 milliliters equals 10 milliliters. Always convert percentages to decimals or fractions before performing calculations to ensure accuracy. Question 19. What is the most effective way to break the chain of infection at the mode of transmission link? A. Isolating the infected individual. B. Administering antibiotics to the host. C. Practicing proper hand hygiene. D. Disposing of contaminated needles safely. Answer: C. Practicing proper hand hygiene. This question assesses understanding of the chain of infection and effective infection control practices. The mode of transmission refers to how a pathogen travels from one host to another. Practicing proper hand hygiene, washing or using alcohol rub, is highly effective because it directly interrupts the transfer of microorganisms, especially through direct contact. While other options like isolation or safe needle disposal are important, hand hygiene is a pervasive and foundational method to prevent transmission across many scenarios. Remember that breaking any link in the chain can prevent infection, but hand hygiene is incredibly versatile and powerful. Question 20. When communicating with an unresponsive client, what is the most appropriate approach for the nurse? A. Assume the client cannot hear and speak only to family members. B. Speak loudly and slowly to ensure the client understands. C. Talk to the client normally, explaining procedures and observations. D. Use medical jargon to convey professionalism. Answer: C. Talk to the client normally, explaining procedures and observations. This question addresses effective communication with all clients, including those who are unresponsive. It is a fundamental principle of nursing to assume that unresponsive clients can still hear and understand. Therefore, it is most appropriate to speak to them normally, explain what you are doing, e.g., "I'm going to check your blood pressure now," and describe observations as if they can hear. This approach maintains dignity and respect for the client. For example, before repositioning an unresponsive client, explain what you are about to do. Always treat every client as if they are fully aware, as hearing is often the last sense to go. Question 21. Which organ is responsible for filtering waste products from the blood and producing urine? A. Liver. B. Lungs. C. Kidneys. D. Spleen. Answer: C. Kidneys. This question tests your knowledge of basic anatomy and physiology, focusing on the function of specific organs. The kidneys are vital organs of the urinary system, specifically responsible for filtering waste products, excess water, and electrolytes from the blood to form urine. The liver has many functions but primarily detoxifies and metabolizes, lungs are for gas exchange, and the spleen filters blood but is part of the immune system. For instance, without functioning kidneys, waste products would build up in the body, leading to serious health issues. Remember that the kidneys are the body's natural filtration system. Question 22. An LPN is assisting an RN with client care. Which task can the LPN typically perform independently without direct supervision? A. Developing the initial nursing care plan for a new admission. B. Providing education on a complex new diagnosis. C. Administering a prescribed oral medication. D. Completing a full head-to-toe physical assessment. Answer: C. Administering a prescribed oral medication. This question assesses your understanding of the LPN's role and scope of practice in a team setting. While LPNs work under the supervision of an RN or physician, they can independently perform many routine and stable client care tasks, such as administering prescribed oral medications, after confirming the 5 rights of medication administration. Developing initial care plans, providing complex education, and completing full head-to-toe assessments are typically responsibilities of a registered nurse due to their broader scope requiring advanced assessment and critical thinking. An LPN often collaborates on the care plan but does not initiate it independently. Question 23. A nurse is advising a client on healthy eating habits. Which food choice is an example of choosing a whole grain? A. White rice. B. Enriched pasta. C. Whole wheat bread. D. Corn flakes. Answer: C. Whole wheat bread. This question tests basic nutrition knowledge, specifically identifying healthier food choices related to carbohydrates. Whole grains contain the entire grain kernel, including the bran, germ, and endosperm, which are rich in fiber, vitamins, and minerals. White rice, enriched pasta, and many corn flakes are refined grains, meaning they have had beneficial parts removed. For example, choosing whole wheat bread instead of white bread provides more fiber, which aids digestion and helps manage blood sugar. Always encourage clients to choose whole grains over refined grains for better nutritional value. Question 24. In the event of a fire in a healthcare facility, what is the correct sequence of actions for the nurse to follow? A. Alert, confine, evacuate, rescue, ACER. B. Rescue, alarm, confine, extinguish, race. C. Alarm, extinguish, confine, rescue, AECR. D. Confine, rescue, extinguish, alarm, CREA. Answer B. Rescue, alarm, confine, extinguish, race. This question tests knowledge of essential fire safety protocols in a healthcare setting. The RACE acronym is a widely accepted and crucial sequence of actions to remember during a fire emergency. It stands for rescue, anyone in immediate danger; alarm, activate the fire alarm and notify others; confine, close doors and windows to contain the fire; and extinguish, attempt to put out small fires if safe to do so, or evacuate. Knowing this sequence helps ensure the safety of clients and staff during a critical incident. Practicing fire drills reinforces this vital memory aid. Question 25. A client's oxygen saturation reading is 88%. What is the nurse's priority action? A. Document the finding and reassess in 30 minutes. B. Encourage the client to take deep breaths and apply supplemental oxygen as prescribed or per protocol. C. Notify the physician immediately without further assessment. D. Administer a bronchodilator without an order. Answer B. Encourage the client to take deep breaths and apply supplemental oxygen as prescribed or per protocol. This question assesses your ability to prioritize nursing interventions based on a client's vital signs and potential compromise. An oxygen saturation of 88% is below the normal range, typically 95 to 100%, and indicates hypoxemia, meaning low oxygen in the blood. The priority action is to intervene to improve the client's oxygenation immediately. Encouraging deep breaths and applying supplemental oxygen, if there's an existing order or facility protocol, directly addresses the low oxygen level. While documentation and physician notification are important, immediate action to improve oxygenation is critical for client safety. Remember that maintaining adequate oxygenation is often a top priority in client care.